Okay, so this is 529, and we're talking about positive and negative reinforcement. That is Skinner. So I'm going to share my screen with you and give you another graphic. So positive and negative reinforcement seems to be something that a lot of people struggle with. If you think about the concept of adding and taking away, not good and bad, adding and taking away, that's what that means. So if you get a positive punishment, that is someone spanking you, right? When my mother spanked me, she said, this is good for you. I don't know what she meant. It's a positive punishment. So in the question, what you're looking for is, are you trying to start the behavior, or are you trying to stop the behavior? When I'm trying to start the behavior, I like it and I want it to continue. That's always going to be reinforcement. I am reinforcing the behavior. Okay, so I'm going to reinforce behavior by adding something or taking something away. I always use the same one usually, because for most of my clients, you have a significant other, and that works pretty well. So your significant other, you've asked them forever to do something, right? Oh my gosh, you asked them to do laundry, right? You've been together with this person forever. You're like, oh my gosh, just please help with the laundry. Please help me. Please help me. You come home and the laundry is done. Not only is it washed, it is folded and put away. Oh my gosh, you're so excited. I can't believe this is happening. Yes, right? You like that behavior. You want it to continue. So you're going to reinforce it because I like it. I like it. I'm going to reinforce by adding something, which is positive, or reinforce by taking something away, which is negative. Okay, so if I add a positive reinforcement, I'm going to say, baby, you did the laundry. Let me give you a little something, something. Yeah, right? Kiss, hug, trip upstairs, trip to the dining room table. It doesn't matter, right? Something that's going to reinforce that behavior. I'm adding it on. I'm giving something. Now, the negative reinforcement is the same thing, right? I like what he did. I wanted him to do it again. So I'm going to take away something that he doesn't like. I'm removing a negative stimuli. So I'm going to say, baby, I'll tell you what. I'm going to go and spend the day with the girls, and you can spend all day Saturday watching football. Oh, wait. I'll wash your car because I know you don't like to do that. So I'll do that for you since you did something for me. I'll take out the trash. Any of those things, I'm removing something that he doesn't want to do anyway. So that is reinforcing the behavior. For example, let's say that you, your job, right? You've gone to work Monday, Tuesday, Wednesday, Thursday, and your boss says, "Oh my gosh, Dr. Pam, you're the most amazing employee I've ever had. Why don't you take Friday off?" Yeah, right? Long weekend. That is negative reinforcement. I didn't want to work Friday anyway, right? So they're removing that from me. So now remove a negative, removing a stimuli, something I didn't want to do anyway. That's what I'm doing. Okay. So punishment, of course, we all know punishment. Positive punishment, it's not a good thing, right? It's just adding or taking away something. So positive punishment is giving something. So your kid comes home from school and he hasn't done his homework, or you get the letter that talks about, oh, your child is way behind. So a punishment would be then to add on something, to give him something. Extra chores. I may give him a stern talking to, that disappointing look. A spanking is a positive punishment. Remember that. So then when a negative punishment is the reason that we bought all those lovely toys, right? So we can take them away. Negative punishment is taking away the PlayStation, the phone, the car. Timeout is a negative punishment. I'm removing them from the positive, right? All the good stuff that's happening, I'm removing that from them. Okay. So that is Skinner. Skinner looks at reinforcement. He looks at positive and negative behavior. He's a behaviorist. So when we look at the questions, we're always going to be reminded that he is the one that doesn't. He really said, people are like animals. I can teach them anything. Okay. Questions, guys. It's really okay to ask me questions. Okay. I'm going to go and just kind of talk about our theorists in general. Okay. Let's see here. Let me use a different book for once. I can do this. Let's use my Hellwig book. Let's branch out today. The key to learning the helping professions and learning the theorists really is one of the largest parts of the test. Once we get those down, you got this. You really do. There are so many theorists, right? And we have to know them because they're going to be both in the group section as well as the family section and the individual section. They're all going to be in there. So we've really got to know them. Let me use NCE secrets. I'll put that in the chat box if you don't have it. And again, I always say we want to read from more than one resource. The Purple Book guy swears that he's the most amazing person ever, and he really might be. However, his questions are not the way the test is written. At one point they might have been, but they are not right now. So as I'm going through, let me go back. Give me a second for the content to kind of go over what it looks like for you. Okay, so your human growth and development, those are your Freud people, right? Oral, anal, unconscious, Piaget, all those people. Social and cultural diversity, that's where you learn those terms like etic and imic and alloplasty, your racial identity moment, all of those things come from there. My helping relations, that is what we're looking at today. Group work also, you have to know the ages and stages of group, but you'll find that the human growth, the helping professions are really going to follow into group work. They'll talk to you about, this is the therapist you have, and what therapist would use this. Okay, so let's kind of go look at that one. That is on page 15. Okay.
I have another question.
Yes, go ahead.
So, and I know you're going to get to it, but when I took the test, I know.
Who is this?
Freud, Tequila. I'm sorry.
Thank you. No, that's okay. If you keep going, I'll recognize your name, Tequila. I'll recognize your voice. Go ahead.
Okay. So Freud, I noticed he was a big, like, in layman's terms, a mentor, it seemed, to a lot of theorists.
Freud was the first person that ever came up with talk therapy. Prior to Freud, we didn't talk to anybody. We looked at ice baths and lobotomies and all of those things. We had no idea that we could actually talk to a person. Okay, so that's why he's the father. He really is. But go ahead with your question.
So sometimes I get a little confused because other theorists like Erickson kind of added to or ran with his own.
He did.
It kind of gets confusing sometimes, like, oh, that wasn't Freud, but it was this person. But it just seemed like their theories kind of went together a little bit, if I'm saying it right.
Okay. You are. Okay. So let's stay there for a moment. Okay. So what we're looking at is Freud is the He's the father, right, of psychoanalytic theory, things that are unconscious. We have neo-Freudians. Those are people who came along after Freud who did not believe that the id and the superego had the same fight. That, you know, my id is my devil, right? It's my devil principle. Like I want it. And my the superego is the angels, so are both fighting on my shoulders. I'll do this, do that, do this. But many of those, so Erickson definitely was he was psychosocial. A little bit of that was unconscious, but more he talks about his ages and stages. He's considered a developmental guy. And those are more that early stages. So we probably won't get to a lot of Freud tonight, but we'll talk about some of the Freudian people who followed Freud. On the test, what we're looking for is the key word. So if I see psychodynamic, that is shorter term for what we're doing now. Okay. Psychoanalytic is the longer term. And that, again, Freud believed everything was in the unconscious, and his job for him or any other psychodynamic person, psychoanalytic, was to bring the unconscious to the conscious. Okay. So hold on to that. We may get into that today. If not, it's going to be under that, the developmental theorists. Okay. So Carhuff.
Thank you.
You're welcome. You're welcome. Carhuff. He's one that you'll see. So Carhuff talked about he's the person that looked at the theorist. Looked at the theorist from the point of view he looked at empathy from the point of view of the therapist. So what you're looking for is those empathetic responses. So he would always score it from a 1 to a 5. On the test, you're very rarely going to see a 2, 3, or 4. Because that's really kind of subjective, right? It's going to be a 1 where the therapist showed no empathy whatsoever, or a 5 where they definitely showed lots of empathy. So for example, you might see a question, I'm coming to the therapist's office and I'm like, oh my gosh, my husband, he moved out yesterday and he took everything and I don't know what I'm going to do and I'm crying. And he says, well, Pam, did he leave the lawnmower? Like, what the heck, right? Forget the fact that I'm crying and boo-hooing. That would be a 1. He's not been genuine. He has not been empathetic. Empathetic is recognizing that I'm in pain right now and giving me a very emotional response. Level 5 would be, wow, this must be really hard for you. I can imagine that you're very upset, staying with my feelings. Remember, we don't ever do sympathy. That is for lay people. We provide empathy. And the best way to describe empathy is the fact that we can understand how clients can make very poor choices and separate that behavior from the client. So, you've got a client who left her kids in a car to die when she was seeking drugs. Right? It doesn't make it okay. I'm not going to somehow, it doesn't change her behavior. But I can understand that a drug addict, that getting in their next drug is like breathing. It's not a choice. She didn't wake up and say, well, I'm going to go leave my kids in the car. But to her, it's like getting the next breath. And at that time, when you're an addict, the only concern is making sure that you can survive. And that is something that professionals bring. So we're never going to look at empathy. We're never going to look at sympathy. We're always going to be empathetic. You'll always see these terms. It's my active listening skills. They're always on there at some point. The most important you'll see is reflection. Reflection always talks about the feelings. So it's most often the feelings the client didn't say. Okay, so I think Tequila before, she was talking about Freud and the Freud questions on there. She didn't say anything. She didn't use a feeling, but a good reflective response would be, it sounds like that maybe you're a little worried about those Freud questions. So I'm putting in the feelings that she didn't give me. Thank you. There we go. That's reflection, right? And if you're on spot, on target, the client will keep talking. So you're giving the words the client didn't say. Restatement literally is just what that says. Paraphrasing, y'all went to graduate school. You know what paraphrasing is, right? You change every fifth word and you figure it out. Right? So that's paraphrasing. Okay. So you're putting in a different word for the client to understand. Summarizing happens either at the end of the conversation or at the beginning. So I can summarize what we worked on today, or next week you'll come in and I'll say, hey, remember last week we worked on this and this and this. So summarizing is you're going to be at the beginning of that session or at the beginning of the new one. Silence is a good thing. However, if in the question, silence lasts for a long time, I'm going to say something. And you're always going to stay in the question, right? So the client was silent for several minutes, right? I'm going to say something. I'm going to assess. I'm going to ask him, hey, so why? What's going on there? But silence is a good thing. It also is a good thing for the therapist. It allows the therapist time to kind of think. Confrontation. Most often we're going to use confrontation in a drug question. That's the most common, right? We know as alcoholics and drug users, if they are talking, their lips are moving, they are lying. So you'll see that one, confrontation. However, in the question, if you see the fact that there are two different it's incongruent, it's not matching. So the client says, oh yes, I've really been trying to lose weight. And the therapist said, well, you say that, but you ordered like a double helping of fried chicken last week. That's confrontation. He's going to call her on it because those things just don't match. Structuring. So that is something that you'll see in the question also. Structuring is just structuring the session, structuring the time together. I hope I said to you, I usually say to you when we first start, this is the way that the session is going to look like. I open it up for questions first, then I'm going to do some lecturing, and then we'll have questions at the end. Okay, so that is what structuring looks like. So those are my active listening skills that you'll see. Yeah, talk about empathy, the importance of empathy. Culture awareness. So more of that is really focused on that cultural diversity question. But the first thing always, if there's a question about the client's culture, most often the first thing I need to do is be aware of my own bias, right? Because we all have our own bias. We all have things that like I know and you know, and things that I prefer and you prefer. It's okay. It's okay. If that gets in the way of my job or the way that I treat clients, that's a different story. But we can't pretend we all have our own bias. You know what? I really, really like cherry pie. Tart cherry pie? That's okay. That's a bias, not a bad thing. Relationship building. So remember, when a client comes in, we're always going to establish rapport. That's one of the first things we do first. Is with that therapeutic alliance is where the change happens. So whether that's an individual session where the client and I have really begun to, he's let his guard down and he's trusting me, or in the group session where that's where we're over in that, or we're in that cohesive state. So either way, we're looking at building that relationship. Transference. That's when my client puts feelings onto me. Feelings from a past relationship, feelings of somebody else, and they're putting them onto me. We all have transference. The guy you're dating now, and he's done nothing wrong, but that last guy you dated cheated on you. So you're going through his phone because, Tyrone cheated on you last time, right? So you're bringing up stuff from that last relationship into your current relationship. That's all transference is. Not good or bad, it is. Freud referred to it as the extra person in the room, and Freud actually encouraged transference. He worked with women. He wanted the women to put those feelings onto him. He encouraged that. So transference is just part of it. It's that person in the room. Now, of course, it can be negative or it can be positive. So if that person in the room, my therapist reminds me of my mother that I didn't have a good relationship with, that may not be a healthy transference, but it still is what it is. Okay. In group, you can have multiple transferences, because in the group session, when everybody's on, right, they're all being cohesive and everybody's kind of, giving you feedback, you can have that transference with more than one person in that session. Resistance, that term just means that the client is not willing to change, not ready to change. Resistance occurs when the client declines or avoid seeking help when needed. Be careful with those questions, because sometimes you'll see a person of color who is not doing as you think they should, and that may be deemed as resistance when it's really not. Okay, so that is, be careful when you're looking at that resistance. Crisis intervention. These are terms I haven't gotten to our theorists yet. We're looking at crisis intervention. Crisis intervention, you are going to remember, is that same, always the same steps. Always, always, always. It is the same for everybody. A crisis intervention. Sorry, there's some windows here. Sure, that guy's been teaching all day. We just close out some windows. Okay. The crisis intervention model is something that you'll always see on the test. And what you're looking at, the specific model, is making sure that you know that the stages, or the steps that happen. It's Robert's 7 stages, and we all use the same model. This was developed shortly after 9/11 and after we've had a million school shootings prior to COVID, right? And we looked at making sure that we all knew we're following the same steps. So the first thing you're going to do is you're going to establish safety, right? The code of ethics says that in a crisis situation, we're supposed to help. So it's supposed to be the same, the Good Samaritan law, right? So if you see any kind of tragedy, a car accident, any kind of shooting, you're supposed to help. That is what our code of ethics says. Okay, so when there's a crisis, whether it's a shooting, a bombing, we're supposed to step in. The first thing we're going to do is, it says, plan and conduct a crisis and biopsychosocial assessment. I am not getting out a pencil and paper and looking at a biopsychosocial assessment. What I'm looking for is everybody safe? Lethality is what I'm looking for. Are we in a crisis? Are we all safe? Establish rapport quickly, right? I'm trying to get as much information. Stage 3 talks about get that the last straw, the last thing you heard, the last thing the person said. All of those things I'm going to do before I ask them how they're feeling. Because stage 4, once I ask them how they're feeling, they've lost it, right? Oh my God, I can't believe this happened. And that's human, right? We have lost it afterwards you begin to ask me my feelings. Stage 5, I'm looking at their untapped resources, things that they have already. Do you have friends, family? What's their resiliency like? Stage 6, develop and formulate an action plan. Most often that action plan has already been established. All I'm going to do is remind them of what the action plan is. And then the stage 7 is follow up. The assumption is I will never see this person again. Okay, they will, there's a plan written. They're all going to meet at the wherever place we're going to meet. Your family will meet you there. There's an EAP. There's some kind of program afterwards. So all of those things are things that are already put into place. So that is the action plan. And again, I'm not ever going to look at their childhood stuff. I don't care. It's crisis. Okay. That's it. So go back and pick that one up. I see your email and your text. The goal really is always is understanding content. Once you understand content and know the theorists, you'll be able to recognize them. So it is a learning. It's not memorizing. It's really learning which theorist does what. Okay. These are just terms you should know. Congruence. Congruence has to do, most often when I think congruence, I'm thinking of like Carl Rogers, right? Congruence in general means things line up. What is coming out of my mouth matches my body language. And remember, if they don't match, believe the body. Yeah, okay. I'm not liking this book. I decided no. Let's go back to Helwig. I was going to diversify and try something different. Back to Helwig. He's my dude. Okay. So I mentioned before about Karhuff. Of course, he's always going to be there. He looks at empathy. Like I said, so it's always going to be between a 1 and a 5. My 1 is going to be no empathy. 5 will be the most. Okay. Carl Jung, you might see him. While he is one of my developmental theorists, the terms I'm looking for related to Carl Jung, collective unconsciousness, and Carl Jung is known for my MBTI. He had the archetypes. He had lots of archetypes, but I'm only often looking at the 4 of those. Anima, anime. You'll see there's tons, but I'm only looking for the 4 that are used for the MBTI. That is my Myers-Briggs personality disorder, my Myers-Briggs inventory, but it's based on Carl Jung and his 4 models. The Ma is always going to be the female. So if I'm a female, I have a mus inside of me. Okay. The shadow, you see those horns right there? That's the side of you that I'm not going to let anybody see. Okay, and then persona, that's the cage, that's the mask I put on, also I want you to see. And the self, that is what's hidden. So I don't want you to know about me, and I am not going to share that about me. So that's hidden back there. That's the self. So that is where the MBTI comes from. When you see Carl Jung, those are the things I'm looking for. My MBTI is that 16 questions personality test. You're going to get an E, an I, an S and N, a T and F, or a J and a P. All of those, that belongs to Carl Jung. So what I'm looking for is my Myers-Briggs and looking for collective unconsciousness and my archetypes. Those are 3 clues that would give me that, let me know that it's going to be a Carl Jung answer. Okay. Adler, of course, he talks about birth order. He was my constellation guy. When I'm looking at Adler, I'm always looking at birth order. He used the words inferior or superiority. He said we felt inferior based on the way that our birth order. So remember, if there are more than 8 years between the children, I'm sorry, 7 years between the children, Adler said that second set, after the 8, you started all over. So that'd be another firstborn. Adler also came with those lovely terms of spitting in your soup. Do you know that term? So what Adler would say is that, a client comes in and they've got this wonderful idea, this wonderful plan, or what they think is going to work out, and he would literally kind of spit in your soup. He would tell you how it probably wasn't going to work. Okay. It comes from an old German proverb, and it really was a technique used to decrease the client's symptoms by determining the underlying purpose for them, pointing out the symptoms, the purpose to the client. And Adler believed even if the client chose to maintain their systematic behavior, she could only do this with the realization that somehow she was benefiting from it. So you've got this life plan going on, and this is what I think is going to happen, and this is working. And Adler would say, well, how's that working for you? That's a Dr. Phil thing, right? How's that been working for you? That's the technique of spitting in the client's soup, helping them kind of realize this isn't working for you. Okay. So he also used a couple of terms, those sour grapes and sweet lemons. Also belongs to Adler. based on those Aesop's fables, right? So you want the grapes, right? You're looking at them and you can't get them and you say, oh my gosh, they were probably sour anyway. Depicts our tendency to despise what we fail to get. I didn't want it anyway. So the sour grapes and the sweet lemons, that terminology you're going to see, that belongs to Adler. Gordon Allport and Kurt Lewin, you might see those. Lewin is actually known for his, is called the, so we talked about how we do or how we don't make changes. It's kind of like the pros and the cons of the change. So he would say that we have, there it is, force field analysis. So Charles Lewin is known for the force field analysis. He said that when we're trying to make a change, whether it's personal with a client in an agency, there's forces that are pro and forces that are con. Okay, so then you would list the change, things that are for the change, and list the things that are against the change, the resistant, and you give them points. Okay, and once you gave them points, then you would really tally up. You'd analyze and you'd apply. That's called a force field analysis, and that belongs to Charles Lewin. Okay, Kurt Lewin. So that's force field analysis. So really kind of adding up those things and going back and forth and giving them points, and that's how you make decisions. Of course, you know Beck. Beck is my BDI, my Beck's depression inventory, or my BAI, my Beck's anxiety inventory. He was my CBT guy, right? He talked about the thoughts in our heads. He said it's that irrational thinking. So when I know it's Beck, I'm looking for a term that talks about restructuring, changing their cognitions, changing the way that you think. That is CBT. Beck had both a depression inventory as well as an anxiety inventory. Joseph Wolpe, you probably know, he came up with that systematic desensitization, which is the opposite of flooding. Flooding is you get in, you do it all at the same time. Systematic desensitization is the slow way of doing it. Meckenbaum, he did my stress inoculation theory. What he said is we could prepare ourselves for stress. We knew it was coming. We should be physically physically prepared for it, emotionally prepared for it. And he actually said we should practice it as well. Okay. Johari window, I've gone on that a couple of times. Did you use that in group? Johari window looks at the changes we make. He said there are 4 categories, and of those 4 categories, one change in all those categories would change everything. Go back to these. You'll see these often, those theories of consultation. You might not see the names, but knowing which theories those are. So then if we look at Bergen, he was a behavioral model, right? So any kind of behavioral change is always going to be the same thing. We don't care about any of the feelings, just changing the behavior. Bandura, you know him from careers, right? He was my self-efficacy person. He said we fight for ourselves. He's also our social learning guy. He said that we learn by watching others. That's how we learn to get on an elevator, right? Because of we watch other people do it. That Shine model, he talks about it's a doctor-patient. So it's more process, but that theory of consultation is you're coming in and you're coming into the consultant is coming in to kind of teach you some things to fix you. It's a doctor-patient, and Kaplan, of course, is the mental health consultee. So 2 professionals and centered on the client, the consultee, and the focus on the client and the consultee. And that's looking at that emotional piece that's going to be in there. I'm going to give you that term. Remember this one? So this is my compassion fatigue. Compassion fatigue is a combination of both secondary trauma as well as burnout. So secondary or vicarious trauma is hearing your client's story, right? We're hearing it again. So we're being hurt by that. And then my burnout is what happens at the job, the everyday, the people, they get on my nerves. Oh my gosh, the clients, the job, the mold, the smell, all of those things are burnout. And then together, the burnout as well as the secondary or vicarious trauma, that is where my compassion fatigue would come in. Okay. So looking at some of my people, right? Person-centered is Carl Rogers. You're looking for those lovely terms, right? Congruence. So looking at the client was the expert. He didn't believe that you should ever diagnose, right? Because that kind of pathologicalized some of the problems. If you look at Carl Rogers, he was more of a teacher. Let me go back and pick this up from a different spot. Carl Rogers was more of a teacher when it came to working with his clients. These are family guys. I'm going to go back to our. I will share this with you, but this is one of my kind of favorite ways of looking at all of those theorists. And actually, let me put this really cool slide. 1 second. Any questions, guys? I'm just pulling something up on a different screen.
Is this slide that you're showing in the, this is tequila, in the CPCE book?
It is in the Hellwig book, and I'll put a copy of that in the chat box.
Okay.
Yep.
Thank you.
Yep. This is kind of a neat little cheat sheet. Okay. And this kind of helps us look at knowing the theorist. Okay. And we're looking at the key terms of always of who I'm looking for. Okay. So Adler, we talked about him. He's talked about that, you know, the birth order. He talked about being inferior, feeling inferior, superior. Existentialism, of course, that belongs to Rollo May or Viktor Frankl. Like, why do I exist? What is my purpose in life? My person-centered therapy, that's Carl Rogers. Carl Rogers talked about, you know, why the client is the expert, right? And we are there just to support them as they are the expert. Gestalt is my here and now. He looks at getting rid of my unfinished business, right? And making sure that we're working always in the here and now. Gestalt was Fritz Perls. And always looking at him, you always talk about the wholeness. He believed that a person should be whole. In order to be whole, then you had to get rid of that unfinished business, the empty chair techniques. My behavioral people, he said behaviors can be learned. That's going to be Skinner as well as Pavlov. CBT, that belongs to Beck, right? Beck said that it's not, there's anything wrong with, he didn't believe it was a genetic piece, or he didn't believe that anything, we were any kind of neurotransmitters or any issue like that. It really was just a matter of our faulty thinking. Reality therapy, that belongs to Glasser, right? Glasser said reality therapy, looking for the words responsibility and choice. So we had our freedom of choice. However, there was a lot of responsibility that went along with those freedoms. And then DBT, that belongs to Marsha Linehan. That is the theory that we use with our borderline personality disorders, right? Love you, love you, love you. Hate you, hate you, hate you. That's where those come from. Mindfulness, that belongs to dialectic behavior therapy. TA, of course, that belongs to Eric Berne. Eric Berne talked about my 3 ego states: parent, child, and adult. He said that the problem lies is when we are coming from hidden or those ulterior ego states. And when we did that, then we're definitely playing those games, and the games hurt. He wrote the book, The Games People Play. Mindfulness therapy in general most often is one that we talk about when it comes to DBT. The other term you might see is a feminist therapy, right? So my feminist therapists are always going to be looking at the bigger picture, looking at empowerment, making it fair for everybody. So it used to be just for women, but it's not anymore. Okay, we'll go over this one again. So this is kind of, and you'll get this as we leave. The attending skills, paraphrasing. Timing, you might see that. So I've seen that in a couple of questions. So the errors of paraphrasing and reflecting. Timing, when I reflect every statement or wait too long to repeat the whole message. Stereotyping, I begin the same way every time. Depth, I'm reading too much into the message or the language, inappropriate to the level or experience. I'm using a language or verbiage that my client may not understand. Okay. Again, psychodynamic is short-term of Freud, right? So that's psychoanalytic theory, but it's going to be short-term for psychodynamic. My id, ego, and superego all plays a huge role. My id is my devil. My devil made me do it. That's my pleasure principle. Oh, right? My ego is who I am. We look at ego strengths, ego supports. My superego, that's my angel, right? So my id wants what it wants, and it wants it now. And then my superego says, no, 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 no. But the ego is me, right? Because the ego says we have to do some of these things. The id says, eat, sleep, and procreate. If we can't do those things, society wouldn't go on. And of course, with Freud, all of these things were unconscious. He said that our defense mechanisms protected us from anxiety. So it would protected us. Imagine displacement. I'm really upset with my boss and I want to go punch my boss. It's better if I displace that anger into a more appropriate place, right? Yell at my kid, yell at the dog, whatever. That is safer for my ego. So my defense mechanisms were protecting my ego, according to Freud. Those are your defense mechanisms. All your Freudian stuff. We should talk about him again into human development. We mentioned Carl Jung. Carl Jung is the MBTI. He belongs in my collective unconsciousness. Again, I'm looking for reminding you of terminology of who belongs to who. Adler, so inferiority, striving for superiority, that term lifestyle. That's the way that I choose to compensate for always feeling inferior. Dreams, that belongs to all of my psychoanalytic people, not just Freud or Adler or even Jung, to all of them. Neo-Freudians. So Neo-Freudians, I think I mentioned before, they believed that things were unconscious. However, they did not believe that the id and the superego played the same role. Okay, so Horty, Sullivan, Fromm, you might see those names. Okay, they are considered Neo-Freudians. CBT, as I mentioned before, that's Beck. He talked about changing your faulty thinking patterns. Aversive therapy, remember aversive therapy is always anything painful, yucky, or gross, which you must often see. Well, antabuse. Antabuse is the stick, the pill, the patch, right, that you put on. And if you, while you're drinking, if you're wearing it while you're drinking, you will be violently ill. Albert Ellis, I don't know if I mentioned him or not. He's my REBT guy. He said it wasn't the issue. The issue was not the event. It was the way that I processed the event or the way that I saw the event. So it's the ABCD of REBT. So the best example, of course, is always, let's say, not you guys, but someone has failed the test. They failed the test, and he would say, it's not the fact that you failed the test, it's the problem. The problem is the belief system that you have. So, oh my gosh, I failed the test, and I believe that I'm awful. I'll never be a good therapist. I can't believe it. The emotional consequences, of course, is, you're swapping professions. You're not giving your best because you believe that you're not a good therapist. D, of course, I'll go and I'll dispute that. Like, wait a minute here. Look at the people around you that have a license, and they're not licensed. They're licensed and definitely not so great. Okay. And then E is going to be my effective new belief system. So the ABCD, okay, is going to be the REBT of the EBCDE of the REBT that belongs to, of course, Albert Ellis. Okay. And you'll see it's a lot like CBT, but of course, we're always looking for that faulty belief. It's not necessarily my thinking patterns, it's my belief system that's wrong. Person-centered, Carl Rogers, he's considered humanistic. So is Maslow, because I looked at putting the person first, his terms. Accurate, empathetic understanding, congruence, genuineness. Okay, congruence means, again, my body and my mouth actually line up what I'm saying. Gestalt, I'm looking for wholeness. He believed that we can be a whole person when I get rid of the past and bring it forward. We talked about TA, that's parent, child, adult. You might see this one, the Cartman drama triangle. He said that there are 3 roles that people play to get their needs met. Okay, so the victim, the persecutor, and the rescuer. And people often switch roles during the same situation. So you'll see those questions. So the victim is the one, it's always about me. The rescuer is going to come in and save the day. And they really are simple as they sound, and nothing more than really understanding those 3 terms. That's Glasser, Reality Therapy. Rollo May or Viktor Frankl, both belonging to existentialism. Why am I here? What is my purpose in life? Why do I exist? There's purpose in suffering. Lazarus. He's my multimodal guy. You're looking at all 7 of those. So I always try to think of like Lazarus, he rose from the dead in the Bible. Not this Arnold, but, in the Bible, Lazarus rose from the dead. But he talks about looking at all 7 of those modalities. Behavior, your affect, your sensation, your images, your cognitions. All of those things would belong to that multimodal, that is Lazarus. NLP, that neuralistic programming, what that means is that we're going to make sure that we talk to the client in a mode that they understand. So a therapist learns clients' preferred sensory mode of communication, either visual, auditory, and kinesthetic, and I'm going to join in the same mode, right? So I'm going to respond, talk to them in the same mode that they're sharing with me. I'm going to my family theorist. I don't really want to go into those today. We talked a lot about those under family therapy. Those terms you need to know. Most often you'll see those in group, but make sure that you understand those. Primary, secondary, and tertiary prevention. So it's a public health model. What I'm looking at is ways of protecting the public. So whether it's COVID or substance abuse or drug and alcohol abuse, that's what this is based on. Primary prevention gets everybody. The DARE program that everybody had to have in elementary school or middle school, that's everybody. That's primary. With COVID, primary prevention talked about the importance of everybody getting their shot or everybody staying away. 14 days if you're exposed to it. That's my secondary prevention. And then tertiary is going to be everyone who's already had it. So whether that's someone who's a former drug user, someone who's recovering from COVID, someone who is they're in a halfway house, right? Because they're clean now. All of those things would belong to my prevention strategies, and that was a tertiary one. Okay. I'll make sure that you get this. Lots of information in this one, so I will share this with you in your chat box. Okay. I'm going to pull up some questions, guys. Do you have any questions for me as I pull up questions?
Tequila here. So really quick, CBT belongs to Beck, which is the faulty thinking. Beck,
it is,
right?
Yeah.
Okay. And Albert Ellis, because these were the two I saw and I confused them a lot.
Okay, because they sound a lot alike.
Right. Albert Ellis, which is the REBT, which has to do with the belief system.
Right. He would say it's a faulty belief.
Oh.
And what happens is when you have that faulty belief system, then you're also then that's going to have emotional consequences. So if I can dispute that belief system, then you will therefore not have those emotional consequences. CBT just talked about changing your thought patterns, changing how we see things, how we think about things. And we'll give you that one too. The answers are with that one. That's the helping professions. I'm going to, of course, do my AATBS because that's so hard. I don't do it because it's so hard. I do it because I like to help challenge you the way you think about the questions. So AATBS always talks about what is the, I'm looking for the best of those 4 answers. The one that's not so bad. I'm closing out some windows. Of course you may.
Hi, this is Shamila.
Yes.
This is a really good group session. How long do we keep the recordings? Well, how long
forever and forever and forever, if you
Okay.
would like. So it'll be in the chat box for 30 days. Okay. And then so you can put it, actually what will happen is you'll find later on today a YouTube link for the section, but you'll also find just the actual chat section, this actual the recording from today. They'll both be in the box. Everything will be in this box for 30 days. Any material that I use, it'll be there. So right click it, save it to your desktop, save it any place you want to get it, but after 30 days, it will be gone. I'm not going to lie to you. After 30 days, you have to buy it. How about that? So 30 days it's in this box. I save it to a YouTube video, and then we actually offer them for purchase later. So if you don't have it and you just can share with Prudence that you paid for the session already, then she will make sure that you get it. So we keep them forever. Okay, so we're going to look at some questions. I'm using AATBS. It is harder than the test will ever actually be. I like this because it helps you with the vagueness and learning to kind of read between the lines. And I think that's the biggest issue for the test sometimes is really kind of figuring out what they really want me to know. Okay, you see this one? Aaron Beck's cognitive triad consists of. Now I'm thinking, oh my gosh, what does that mean? So what I know that we talked about Beck, we know he's the CBT guy. We know he talked about anxiety and depression. We know that he really believed that faulty thinking caused my issues. So let's look at these and figure out which of these things might belong to Beck. I see a D in the group. Let's rule out, right? So antecedents, behavior, and consequences, that's an FBA. That is a behavioral analysis, right? So I don't think that's going to be it because I see a lot of the consequences and not expecting to talk a lot about consequences. Negative beliefs, positive thoughts, and everyday actions. Again, beliefs belong to, right? We just talked about this. That belongs to who? REBT, right? The belief system. Okay. So the thoughts, negative thoughts, that's probably my answer, right? Okay. Because I know that what Aaron Beck said, what it was my sinking thinking, right? So I may not have any idea what this cognitive triad meant. Like, oh my gosh, it's Beck, and they use these big words and I have no idea what I meant. So I'm going to rule out. I'm going to rule out what I know. Okay, memory, language, and emotion. He didn't talk anything about that, did he? He really believed that depression or anxiety was an issue with our thinking. So that's where I get answer D. Make sense?
Yes.
Good. Very good. Hit my bell. Okay. So which of the following is least likely to be a part of brief psychotherapy? Okay. So homework assignments, seeking additional sources of support, psychoanalysis, or a psychodynamic orientation by the therapist. It's a least question. Okay, so 3 of these things would be a part of brief psychotherapy. 1 of these would not. Tequila, are you on my line?
Yes, I am.
Okay, what'd you pick for this one?
Oh my God. I want to say C.
Okay, because?
I think of Freud when I think of psychoanalysis, but he was a talk therapist. He was the father of it.
Okay.
So that has to be
Okay.
wrong.
And it was, oh, girl, don't doubt yourself yet. Don't talk yourself out of it. Oh my gosh. Okay.
That's the problem with my exam.
Okay. So we're not going to talk ourselves out of it. We're going to prove it. We're going to prove it in the question. Okay. So the least likely to be a part of brief psychotherapy. So the answer is C, right? But why? You can't read the answer. Why? Anybody?
Because C is Freud.
It is Freud. And Freud believed that the psychoanalytic was long. You lay on his couch forever, right? Psychodynamic is the newer Freudian one where it's short, but psychoanalysis, I mean, you could stay in therapy for 5 or 6 years because he's pulling up all that stuff from your unconscious. So that's why it's going to be C. That's the least likely. Homework assignments, additional sources of support, and psychodynamic all are going to be brief parts of psychotherapy. And when we say brief, that means like 8 to 12 sessions, okay? So if you're a Medicaid provider, and I know you see kids for like 37 years, that is not what the test is looking at, right? Brief therapy, CBT is considered to be about 12 weeks. Okay. We talked about these. Okay, these are those active listening skills. My teacher is driving me crazy. I can't do anything right in school. I do these math problems. I do them the way she told me to do them, but she's like, here, do them this way. After I did what she told me to do, The counselor says, you are frustrated by the way your teacher treats you. The counselor's response here is an example of what? Confrontation, interpretation, reflection, or summarization.
Interpretation.
Tell me why.
Because she's interpreting in short what the client is explaining.
She said, you are frustrated by the way your teacher treats you. Okay. So do you see some feelings in there?
Oh, gotcha. Okay, yeah.
You see some feelings?
A.
Did he say anything in there about how he feels? The kid?
Okay. Yeah, crazy.
The teacher is driving me crazy. I can't do anything right in school. I do them this way, and she tells me this, but she's like, here, do them this way. Okay. So he says you're frustrated. He's giving him the feelings that he didn't say. That's going to be reflection, right? He didn't say that he was frustrated. He makes me feel crazy. So when I'm going to have a response that includes feelings, that's always going to be reflection. Confrontation would be like, boy, that teacher ain't telling you nothing. No, you wouldn't do that. But it really would be confronting the kid. It would be like, well, you know what? Last week you said the homework wasn't so hard, and now you're telling me it's hard? Okay. The confrontation is, again, we're using that with drug users. Always you're going to see that one. Interpretation, let's just keep going. You'll see some of them other questions. We'll see what it looks like in a question. Oh, look at this one. Which would be the least likely treatment as a treatment for post-traumatic stress disorder? Okay. I didn't discuss EMDR. EMDR is that rapid eye movement. So the goal is that the client will follow, his eyes will follow you. He's supposed to be bringing up, thinking about the painful event, whether it's war or child abuse or anything like that. He's thinking about that while his eyes are following your finger. And the goal is that you cannot do two of those things at the same time. So while I'm trying to desensitize myself from this pain, the goal is that I'll focus on my eye will focus on your finger, and I won't be able to feel that much pain anymore. That's the way that it works. Okay, so imagiotherapy, that last one just means that you're really going to imagine it. Exposure therapy is one of those, like flooding, right? I'm going to kind of put you back into where it was. And then implosive therapy is in your head. Implosive therapy is it's flooding all at the same time, but you're doing it in your head. You're processing it through imagination. So I do know that EMDR is the recommended treatment for post-traumatic stress. That one's got to be in. Which one would I not use?
D.
Because? You're right. Why though? Involves consciousness of normally unconscious drives to heal childhood wounds by virtue of our choices and behaviors in intimate relationships. It just wouldn't be a good fit for this therapy. And most people don't know D, and that would be fine because I know what the rest of them are, so I could rule it out. Good job. Let's stick with this one. How would family therapy be most helpful in treating a substance abuser? A, you could use the family to build coalition to support the substance abuse behavior. B, it would allow you to maintain diffuse boundaries between the substance abuser and the family system. It would allow you to maintain strict boundaries between the substance abuser and the family system. D, it would allow you to gather information about the substance abuse history. So how would family therapy be helpful in treating a substance abuser?
I would right away, Dr. Pam, look at A and C. I would
A
rule
and
that
C.
I would rule that in right away.
Rule them in or out? In?
I would rule those two in right
Okay.
away.
Okay. You could use the family to build coalition to support his behavior. Okay. So I don't want to support his behavior, do I?
No.
Right.
Okay.
You want to
So
change it.
exactly. So A would be out because I do not want to support. That's codependency. That's
Yeah.
why substance abusers still use, because someone is helping them use. So A cannot be my answer. Okay. C, it would allow you to maintain strict boundaries between the substance abuser and his family system. What do you mean by that? Tell me what that means.
And his family system.
So I don't know. So let me back up. So the goal of the family, right? I don't want the family to be codependent. I don't want them to be so enmeshed. And codependency means that I'm not happy unless you're happy, right? So I'm enabling this person. And a wife married to a husband who's a substance abuser, like, her happiness depends on his happiness, and that means allowing him to continue to use. So those are my enmeshed boundaries. I don't want that. So I don't want A or B. Now, C is my strict boundaries. So how would family therapy be the most useful in treating a substance abuser? So C and D are still in. So when I'm down to 2, I'm going to compare the 2 to each other or go back to the question and prove it in the question. And most of us can get down to those 2, right? So what do we do? How do we figure out between C and D? Anybody?
Well, not to overthink it, but usually with an abuser, a substance abuser, you at some point you have to have good boundaries in the family system. To stop the borrowing, to stop televisions from disappearing, and so on and so forth. And I think everybody have to just stand together, not to overthink it, to stand together to try and help this family member overcome their problem.
I see you're going with that, because we part of that, especially if the intervention, right, is we're going to stop what we're doing to change their behavior. I see where you're going. However, the most helpful part of family therapy is to actually gather more information first.
Yeah.
Mhm.
And
Okay.
Dr. Pam, one of the key words in C is that there is strict boundaries. You don't want the boundaries to be so
I
strict.
do not. I do not, right? Because I don't want them to have nothing to do with their substance abuser. This is still their family member.
Yes.
I don't want them to cut off their family member. I don't want that. Okay. And what do we know about substance abusers? If their mouth is moving, they are
Lying.
Lying.
yes, always. Okay. So we can never trust what they tell us. They're always in denial. So the best source for the family really is then to gather the information. When it comes to treating substance abusers, we always want to get them to reach sobriety, right? If that's the method you're using, they need to be clean first before we move the family in. Okay, so we're not going to do family therapy until that client is clean first. You want to see the explanation there, guys. I'll put that in the chat box. Good guys, good job. This one. During the first session, a female client complains of headaches, fatigue, and excessive anxiety. The woman says she has a history of anxiety and depression, but that her feelings of anxiety seem to be much more pronounced now. She can think of nothing that precipitated this change in her health and emotional state. The therapist's first concern would be, okay, A, recognize the headaches, fatigue, and anxiety are symptoms of the client's depression and continue working with her. B, include the treatment plan behavior techniques to overcome the woman's anxiety. C, refer the woman to a colleague for a psychological assessment if the therapist is not experienced in assessing the techniques himself. Or D, refer the woman to a physician because her symptoms may be due to a physiological condition. What would I do? And this is what I would do first. I'm always thinking, what would I do first with that client? And go back to the question. She complains of headache, fatigue, excessive anxiety. History of anxiety. She has a history of anxiety and depression, but their feelings of anxiety seem to be more pronounced now. What supports that in D? What words?
You said more.
Come on, you're right. Come on. Tell me why.
More pronounced.
More pronounced. Okay. And nothing's changed.
And nothing's changed.
I'm more anxious, but nothing has changed. Okay. It doesn't say how old she is, but with women, really, we're always looking at those hormonal changes, aren't we?
So it would be good to
Men
rule
too.
medical first. I'm sorry.
Go ahead.
So it would be good to rule out the medical first.
Always, 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 especially when you have some conditions that don't make any sense. If there's not enough for me to diagnose up here, let's rule out medical. And again, what we know is, again, those hormonal changes, thyroid issues with that can always cause anxiety and fatigue, right? So we're going to rule out medical. And I'm not a feminist, but especially in women, those hormonal issues are really very much related to that. Okay. So remember, we're trying to always gather as much information that we can before we intervene, right? So I don't want to start treating her for something when I haven't ruled out those medical issues first, and there's not enough in here for me to diagnose her. A Gestalt therapist must be interested in which of the following. Gestalt is the here and now. He talked about the wholeness. Get rid of your unfinished business. Gestalt terms like self-awareness belong to Gestalt. Integrating polarities, increasing social interest, developing scriptless behavior, or exploring unconscious models. Let's rule out. It can't be D, can it?
Can't.
Because Gestalt was talk about unconscious. That would not be D. C, developing scriptless behavior belongs to TA, transactional analysis. He said in that childhood state, we develop these scripts, these childhood scripts we take into adulthood. So that one's not it. So now I'm down to A or B. Which one of those would probably fit? It's Fritz Perl's Gestalt. Tequila, where are you? You're quiet. See, if you ask me a question, I get to ask you questions, okay? Come on.
You do. Oh God, I want to say, I'm looking at B, but I have to go with A.
You would go with A. Very good. Very good. Okay. Even if you don't know what A means, you know that Gestalt didn't talk about any kind of increasing my social interest, right? Polarities, he talked about getting rid of the unfinished business so I could focus on the here and now. Those are the two opposite ends, right? North and South Pole, polarities are the opposites. I'm going to bring them together. The word Gestalt means wholeness. Good job. This one. So some counselors' behavior have an immediate negative effect on counseling, while others result in a negative effect only when occurring repeatedly and frequently over time. 3 of the following counselor actions have an immediate negative effect on counseling, but 1 tends to have a negative impact when it occurs repeatedly and frequently. So all three of these would have a negative impact. However, one of these would have a longer impact. Which one would that be? It is not a thinking, it's not a thinking test. It's not. It's a reading test or based on some of the knowledge that you have. So let's rule out. Go ahead.
I was thinking 8.
Moralizing and sermonizing. That is one that we use often, but the one that we're often talked about, especially in the Code of Ethics, it talks about self-disclosure. If every session is all about me, how's that going to work out for us?
Not good.
Works out well for me, just not for my client, right? So exactly. So that's the issue. So moralizing, sermonizing, persuading, judgment, all of those I probably shouldn't do anyway. But if every session it comes back to me sharing stuff, that's a problem.
I have a question.
Yes.
Dr. Pam. So when is it wise or uh, even good to do self-disclosure? Because there seems
Never.
to be a
Never.
conflict of interest when it comes to that.
Never.
Okay.
Never.
Gotcha.
Never. Okay. I'm
Gotcha.
not going to say never because never is if we see all and never, those are clues that this is not the right answer. So we're really that's all or never scares me, right? However, minimally, most theorists in the Code of Ethics talks about there's really not a place for that. Okay, so, but this happened to me also. I remember when I was there. No, there's just not a place for that. Okay, this one says moderately use self-disclosure to show authenticity. Most often the answer for the test is going to say we just don't do it. Okay.
Thank you.
And remember, this is not the real world. This is the test. The test that is written for the majority population, and that would be white men. Okay, so what you do in your office every day may be very effective and may work, but that's not going to be the right answer for the test.
Gotcha. Thank you.
Okay. Adler. Adler's driving force can be described as the individual striving to overcome feelings of blank and his or her complementary striving for what? Which of those terms would belong to Adler? He talked about birth order.
C.
That would be it. He said we're always striving to feel superior because we feel inferior. So he said, even if I'm a firstborn, I can be knocked off my throne, right? That second child comes along and I'm knocked off my throne, and then I'm still feeling inferior. Okay. And that's just a matter of knowing which terms belong to Freud, which terms belong to Adler. Okay, so like wholeness, I know that's a Gestalt term, right? Okay, disassociation, that's going to be something unconscious. So I'm just looking for the terms that belong to Adler. A client says he's been hearing voices since breaking up with his girlfriend. He seems to be very angry and unsettled about the breakup, reports feeling of lack of desire to do anything. The counselor, responding with reflection, might say, A, what kind of voices have you been hearing? B, you have been confused and upset since this breakup. C, breaking out of your laziness may seem to help you. I'll say that anywhere in the question, okay. D, it seems as if you have turned your anger towards your ex-girlfriend against yourself. I'm looking for an answer that includes reflection. Reflection always means feelings.
D.
Ding, ding, ding. Right? Oh, no, it was not. It was, you've been confused and upset since the breakup. So D is assuming a way too much. He didn't say that, did he? I saw feelings, but that wasn't the right feeling. Okay. He's been hearing voices since the breakup. He seems very angry and unsettled about the breakup. Reports feeling of lack of desire to do anything. Okay. So it seems you turned your anger towards your girlfriend against yourself. Yeah, not really seeing that, right? So B is my correct answer. You'll see that explanation behind that one. I'll put it in your chat box. Oh, let's see this one. We talked about this, primary, secondary, and tertiary prevention. Which of the following is an example of secondary prevention? A, inner city school children participating in a program designed to increase interpersonal problem solving. B, recovering cocaine addicts participate in a therapeutic support group. C, school children identified as at risk are provided needed tutoring and counseling. Or D, children in urban schools are encouraged through films and lectures to avoid drugs. Remember, my tertiary are going to be the people that are higher or at higher risk. Those crickets that I hear. Okay, somebody help me out here. Well, let's see, somebody chimed in. What was that answer? I see a B. Recovering cocaine addicts in a therapeutic, that would be tertiary because they've already been users. So that would be a tertiary group. A secondary group, or I'm not getting everybody, I'm just looking at the ones who would definitely be at a higher risk.
Would be C.
Ding, ding, ding. There you go. Remember, primary intervention is based on everybody. This public health model actually came from AIDS and HIV. Back in the day, if you're not old enough, if you thought COVID was bad, when HIV and AIDS first hit, we really didn't know how it was spread in the beginning. We just didn't know. There used to be, like, before we had universal precautions, we used to have this like bright neon colored paper that if a person, and we had paper files back in the day, guys. I know, early 90s. You had like this big old neon sheet of paper if someone was HIV positive, because we didn't know how it was spread. So this is where those interventions came from. So the first goal of that primary intervention was to educate everybody, right? Use condoms, don't have unprotected sex, all of those things. And again, at that point, we didn't even know it was like blood transfusions. We didn't know where it came from. So then the secondary one was then you had become HIV positive. So we tried to do a secondary to keep you from getting full-blown AIDS. So that's what this is based from, that primary, secondary, and tertiary interventions. Okay. Oh, we talked about this one. This is transactional analysis, TA. That's going to belong to Eric Byrne. So when is a transaction crossed? Remember, I have 3 ego states, my adult, my child, and my parent. So crossed is when that ego state is, it's coming from a hidden place, right? You know, I thought we were coming to adult, and you've been treating me like a child, and I keep saying, hey, stop treating me like a child. You're like, oh, I'm not doing that. No. So I'm not expecting you. I see a C. Ding, 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 Miss Mika. Very good, right? Okay. Because I'm thinking we're coming adult to adult, right? And I ask you to go, can you help me wash the dishes? Can you help me do something? And I'm like, hey, we're adult to adult. And your response like blows me away. Can't you do it yourself? Like, whoa, we're adult to adult. Okay. So according to the theory, again, this is TA. I've got the parent, child, and adult. The complementary, right? That's when it works out well. However, when the husband says, what time is it? And the wife responds, look at your own watch and leave me alone. Okay, so whoa, that is not what I expected. We're not coming from the ego state. And the ulterior, the hidden is where those cross communications come from. And I'll put that in your chat box. I'm sure all of you have had like perfect relationships with your spouses and your workmates, and you've never, ever done anything like that. But if you had, that's what it would be called. Try this one. In therapy, an Adlerian theorist might use all of the following techniques except what? Okay, so I'm thinking of Adler, both order, unconscious, inferiority, superiority. So which one would he not use?
Would it be D?
A study of the client's dreams. He was a little fruity, and he would probably use that one. I see a C.
Games.
Yeah, because that belongs to TA, right? He wouldn't use that. That belongs to transactional analysis. Adlerian would talk about your family constellation, your birth order. He would look at your dreams. He was a little bit Freudian, right? And he would definitely interpret your childhood memories. But he wouldn't look at those games because that belongs to TA. The games people play, that's the book he wrote. Daydreams, nocturnal dreams, and hallucinations are considered by Freud to be expression of what? Psychosis, a defense mechanism, the primary process, or the secondary process? I see some B's. Those aren't necessarily known as my defense mechanisms, are they? Daydreams, nocturnal dreams, and hallucinations? So let's rule out. So primary and secondary process, I'm not real sure what those terms mean. Maybe, I'm not thinking they're my defense mechanisms. You think they're psychosis that makes me crazy?
Oh, no. So, primary. Everybody has dreams.
Okay. So primary process versus secondary process. So again, those are all unconscious, right? Okay.
Right.
So the only thing on the unconscious is innate, right? Okay.
Dr. Pam, could you break that down a different way? I don't understand. Maybe everybody else does.
I'm sure that's what it is. You're the only one that does understand. Not. You're the only one brave enough to ask. Thanks. Let me look and show you this. Okay. So Freud believed that everything was in the unconscious, right? So what he would say is those innate things that are in your unconscious that I'm not necessarily having to think about to do, those are my primary. Really? Did someone just go to the bathroom? Please mute yourself. Sorry. So, okay, part of your dreams, again, Freud said the dreams were the windows to our soul, right? I'll put this in your chat box. Freud believed that those are his defense mechanisms. Okay, so he said there are two fundamentally different types of psychic process. Again, that's my unconscious. Okay, our process tends to produce a rational organization of dream thoughts. And he said that, so the first one, a normal train of thought would be submitted during I don't know what that was. People don't understand. No. That's way too Freudian. You don't need that for the test. Okay. Primary process, thinking that is oblivious to the constraints of normal space, time, and logic. Secondary process, thinking that is governed by the laws of logic, space, and time. Your primary process are your dreams. Those are the ones that don't have to make any sense whatsoever, that they're hidden in your unconscious. And his goal was that he would pull them out and explain to you what they meant. The secondary ones are going to be more logical. I mean, those are ones that would give a little more thought process, more awareness than your primary process. Concept of primary process, maybe also explain why dreams are creative and allow for problem solving. Here are your first impulses. But when I think of my primary ones, those are ones that are very, when he talked about our innateness, he talked about eat, sleep, and procreate. So secondary dreams, secondary processes just be a higher level of processing. That wouldn't necessarily, that meant it wasn't just the pure unconscious. There was some thought process that went along with that. So dreams, hallucinations, those are examples of my primary process. They're unconscious. So logical, rational thoughts, if you have those kind of dreams, those are more conscious, and those are the secondary process. I don't want to go into more Freudian, because just understand the secondary process ones are more conscious, more aware, and more logical. Did that help?
Okay, that's better. Yes.
114, change through therapy is accompanied by stress, and the therapeutic system must be capable of dealing with it. This statement would be made by who? Glasser, Bowen, Adler, Mnuchin. Now, we didn't discuss Bowen or Mnuchin. Those are both family theorists. Bowen is my generational guy. He did the genogram. And Mnuchin is my structural family guy. It says the therapeutic system must be capable of dealing with the change. And I think this would be like probably something on the question. Like, I know some of these people, I'm just not real sure. I see a couple of answers. I see A. I think that's Glasser. Glasser talked about responsibility and choice. I'm not seeing words in that would support Glasser. Okay.
Mm-hmm.
Okay. So the key to that one, to me, was a therapeutic system and changing the system. So that meant it was probably going to be one of my family people, right?
Mm.
Bowen is my genogram guy, and Mnuchin is my structural guy. So talking about changing the structure, he talked about boundaries. So the importance of having those permeable boundaries, not too tight, not too loose. Okay, so that'd be Mnuchin. A counselor initiating practice of reality therapy, right? Reality therapy is going to be, we just talked about that, it's Glasser, right? I'm thinking of like, you have responsibility, there's lots of freedom, it's your choices, but there's responsibility that comes with those choices. A, believe people are ultimately self-determining. B, not give credence to the notion of success identity. C, believe people believes that personal suffering cannot be changed. A person needs to learn how to live with it. Or D, supports the deterministic philosophy of human nature. If I'm a reality therapist, which would I do? I'm going to take out C because that personal suffering reminds me too much of Viktor Frankl and existentialism, right?
Yes.
Suffering, that's something he would always say. I'm going to take that out. Okay. So now I'm down to A, B, or C. Support the deterministic philosophy. Deterministic means that life is predetermined. I don't have a lot of say-so. I'm going to take that out either, right? Because deterministic would mean that what's going to happen is going to happen, and I don't have any say-so in that. And I don't think that a reality therapy would say that life it's already predetermined. So now let's do A or B. People are ultimately self-determining or doesn't give credence to the notion of success identity. Let's see what I have in my Skype box. I have an A. Let's go with A. Dingo. Yes, yes, yes. Okay. Tough one, right? Tough one. We've talked about reality therapy, and I'm like, oh my gosh, what does it mean? So it was easy to kind of rule out, yeah, Miss Jones, you got this. Okay, so easy to rule out C and D because I know those two don't belong. Okay, so believe people are ultimately self-determining or doesn't give credence to the notion of success identity. Okay, so if you look at your answers there. So both of those terms would belong to my reality guy, right? But the not give credence. I gotta let you go, guys. Questions. I have put in the chat box the material that I went over today. Let me put that cheat sheet in there. I put questions
I have a
with
question.
answers I didn't use today. Yeah, go ahead.
As far as